So we're here with the mannequin, and obviously this is the toughest one to do with a self-palpation. So if you have a quarantine buddy, is what we want to go with. I have the mannequin, so obviously I can use the mannequin, and I can always practice coming down here, and I can practice palpating coming down. I can appreciate where he is right there, etc. Kind of assume that's his posterior superior spine and can move it way up. But not everyone here has a mannequin. So if you don't have a mannequin, one thing that you can do is grab a pillow. Pillow is going to be roughly the same size. I can then use a watermelon for a head. If you don't have a watermelon, you can use a stuffed animal. This is Try. So I'm going to actually replace Try. A little small, but that's his head. And this is just to sort of give us a reference point of where we are. But now we have a torso, we have a head. And what you can also do is take a piece of tape, cut it, and then you can, well, if you want to, you can actually sort of crimp the tape up and give yourself a spinal column. And at least now you have spinous processes. And then you can even use the tape and mark T2 for the superior angle, T7, etc. So then you can just, it's not going to be the same, but you can at least get used to the landmarks in viewing of the spine as compared to the model. You can come down to the pelvis, sort of line yourself up with the waistline of the pelvis, assume, and then you can work your way up. And from here, you can just sort of, again, if you want to use your tape, you can just put tape marks down, but you can visualize iliacostalis, you can visualize longissimus, you can visualize spinalis, you can visualize multifidus, you can visualize the rotors going all the way up, etc. If you feel so obligated, you can also go and grab a towel or a piece of loose clothing or something. You can fold it up, you can put it right there, and now I have a scapula, and you can do the same thing. I can say T2, T7, etc. Is it cheap and cheesy? Yes, but we'll at least give you maybe a physical reference for some of our landmarks on the back. Perhaps, especially those who are very tactile, you can always come down here and say, there's my serratus posterior inferior, serratus posterior superior, my rhomboids, my trapezius, my latissimus, etc. So you can use a pillow, you can use whatever you want. Just give yourself a visual reference point for doing the back.